Yeah, so thank you, Governor McKee, and thank you, Lieutenant Governor Matos. And, good afternoon, everybody. You all should know me by now. It's not like I'm new to you, right? And so we've met before, right? And I just want to talk a little about the Rhode Island Department of Health for a minute. The Rhode Island Department of Health is made of strong people. It's made of good people who do great work. It's an honor for me to step in during this time and be an interim leader during this time. It's humbling to lead such great people. But I want to underscore, the quality of person that I work with is unlike anyone I've ever worked with in my entire career. I've been in the Navy, top-notch people. I've worked with the Indian Health Service, great people. The people at the Department of Health, just an amazing group of people, so it's an honor to be here. I just want to talk a little bit about the pandemic for a minute, though. This may seem like a pandemic that's never ending, but let me suggest to you, we've had 4 seasons of this pandemic. What I mean by 4 seasons of the pandemic is February 28th to March 17th of 21. So February 28th, 2020 to March 17th of 2021, we had the original COVID. From March 17th of 2021, St. Patrick's Day, to around 4th of July, we had Alpha COVID, right? And so things have changed, right? And then we went into Delta COVID from 4th of July till Christmas time, right? And then after Christmas, we got the Omicron. And that's where we are now with Omicron COVID. So, we're in the 4th season of this pandemic, quite frankly. We have 36% of our population who's up to date with the vaccine. So we got vaccine available, but I got 36% of us who are up to date. What I really need people to focus on is kind of move away from the term fully vaccinated. You've gotten the primary series, good for you. I'm glad you got the primary series. You've gotten 2 doses, that's great. What I need people to do is get that 3rd dose, like the governor said. I really need our population to get boosted, not just to get through this season, but to prepare us well for next year as well. Because by the way, as this season comes to a close, I worry about the future as well. Last thing I want to say to you right now is that, this pandemic has not always been in our control. It is in our control now. And I just want that to be something you kind of settle with. It's in our control now. People today got self-test kits. Here's what they're supposed to do with them. If you have symptoms, runny nose, cough, headache, you feel tired, you should do a COVID test. If you have symptoms, you should test. The thing about Omicron COVID, it can sometimes be very subtle when it starts. So part of what I'm just telling you is you have subtle symptoms, please test yourself. If you're positive, it's a treatable pandemic. So we have treatment across the state right now. Now there's some national shortages, but right now there's monoclonal antibodies, the GlaxoSmithKline products, so Trovimab's available. I have oral antivirals. I have some Paxlovid in the state at the 9 pharmacies, as well as some Molnupiravir. So there's some oral treatment here too. So I think we need to think about this like COVID's a preventable, treatable disease. We have the tools we need right now to get through this season and move on with our lives.